Alright, how's it going? My name is Eric. Today we're going to be doing a shoulder evaluation. We have Colton Bean here. Colton is a football player. He plays left tackle. Today he got hurt at practice. And just let us know what happened, Colton.
Alright, so we were doing a drill that consisted of 3 people. We had the running back, me, and the defensive player. I went out and blocked the defensive lineman, and he got me in a compromised position. As the running back came on the inside, I tried to get the better angle, and my arm externally rotated and kind of went back like this. And I felt a pop in his hair. And it's really hurting, and I don't know what to do.
Alright, how was your pain level right now on a scale of 1 to 10?
It's like an 8 or 9.
Have you hurt that shoulder before?
I haven't, but I've been told that I have weak internal rotation and external rotation in the shoulder.
Okay, do you usually do anything before practice? Like stretching or icing?
Just what the team requires.
Okay. Did you feel any numbness or tingling?
I would say I felt a little numbness and tingling.
But did it go away or did it stay
It
constant?
went away.
Okay. What was that pain type? Was it like dull pain or was it sharp pain?
I would say it was really sharp.
Sharp. Okay. Did you take any medication after practice?
I was told to take Advil to control the swelling.
All right. And how far into the season are you right now?
I'd say about 3 games in.
All right. So now we got a good history. So we're gonna go ahead and move into palpation. Palpation. So we're gonna see if any deformity. So you can tell we have obvious deformity right here. It looks like we have a deformity of anterior shoulder and some of the deltoids. All right, now we move into palpation. We're gonna palpate the non-injured side. So we'll go ahead and palpate the SC, work our way out to the AC joint, palpate around the area of deltoids, work our way back towards the scapula, work the spine, and then we'll move into the injured side.
Oh, that hurts.
That pain right there.
That hurts with this.
Alright, so since there's a lot of pain, we're going to discontinue the palpation. Right, then we're going to move into range of motion. So we're going to see his range of motion on his non-injured side. So we'll go ahead and see the range of motion. Right, abduction, pretty good. Shoulder flexion, pretty good. External rotation, decent. Internal rotation, pretty good. Alright, now we're going to go ahead and move to the injured side.
I don't think I can move it.
You think you can move it?
I can try.
Alright, go ahead and try.
I can't move it, it hurts too bad.
Alright, so since you can't move it, we're going to discontinue range of motion, active range of motion, and resistive range of motion. So then we move on to our special tests. We'll go ahead and do our special test on his non-injured side, and then move towards the injured side. So the first test we're going to do is we're going to do apprehension crank. So go ahead and have you go ahead and lay down. Alright, so go ahead and put the non-injured side into position. Any pain there? No.
It's this arm.
Okay. Sorry. Oh yeah. I got nothing there. Right, we're gonna do the clump test. No pain there. Alright, go ahead and have you sit up. Alright. Shoulder down. And turn, rotate. Hold that position, let me push down. Alright, strength is normal. Hold that. Alright, it's pretty good. Go ahead there. Alright, we're going to do AC and SC displacement. Pretty good there. All right, now we're gonna move to the injured side. Since he can't really move it, we're gonna go ahead and just do AC SC displacement to check if possible AC SC sprain.
That hurts.
All right, since he's really point tender, we're gonna stop the special test right there. And then we're gonna move on to sensory and neurological. So we're gonna go ahead and test his dermatomes and myotomes. All right, so go ahead. Go ahead, relax. Go ahead and close your eyes. All right. Do you feel this?
Yep.
Do you feel it even out at both sides?
Yep.
Any abnormal sensations?
No.
All right, we're gonna go ahead and move down. Feel this?
Yeah.
You feel it even out both sides?
Yeah.
Any abnormal sensation?
No.
All right. And go ahead. Now we're gonna test his myotones. So I'm gonna have you go ahead and shrug your shoulders for me, as best as you can.
I can't lift this from that.
All right. So he can't really lift his right shoulder. So we're gonna head and stop our myotones and dermatomes test right there. And then we're gonna go ahead and move on to what we are gonna do for our differentials and diagnosis. So what we have here is for my diagnosis is we have an anterior dislocation with possible labral tears, but since he doesn't really have he can't really move it, we're gonna go ahead and just have that as a possible differential for labral. AC sprain might be possible, but also because he cannot move it, we'll go ahead and keep that differential. We're gonna go ahead and move on to our plan. So we're gonna go ahead and refer him to a physician, have him get MRI to be able to rule out that labral tear, and then go ahead and ice him right now. Have him continue taking anti-inflammatories, and after he comes back from the doctor, we'll go ahead and see if we can get him on a strengthening program for his shoulder.